sometimes you do get what you pay for in certain things. That's why at MidState we pick a select few lines, pick out our favorite products from each, and we know the consistency and quality of those products.
What's the biggest skincare mistake you see people making every day?
Biggest mistake. Maybe over exfoliating their face with like a physical exfoliant, or just too many products. Like nobody needs a 12-step skincare line. So mostly overdoing it rather than underdoing it.
How often should someone really have a full body skin exam?
That has a lot of factors weighing in on it. So one would be, your family's background. Do you have a strong family history of skin cancer? What is your personal sun exposure history? For most people, once a year is enough. Some patients with a history of skin cancer personally or a strong family history, we recommend them come in twice a year. Of course, patients that have a history of melanoma, we would like them to come in at least quarterly for the first few years after their melanoma diagnosis to keep a close eye on it. So there was a range depending on personal factors.
What's the one question your friends and family ask you constantly?
Can you look at this?
Is there such a thing as being too young for Botox?
Yeah, there is such a thing as being too young, but it's probably much younger than what we would think. So when to get Botox is also a very personal choice based on muscle movement and again genetics. So some of us have very expressionate faces. And so somebody like that might need Botox a lot sooner in life than somebody that doesn't move their face a lot, because we get fine lines and wrinkles from moving the muscles of our face. So if you move those muscles a lot and yours are very strong, then you need Botox sooner rather than later. Late teens is not too soon if it's needed, but again, that's a personal choice. Ideally, if you want to prevent wrinkles, we get started prior to having an etched in line either here between your eyebrows or your crow's feet, whatever's bothering you, but that is very age dependent. I had a patient today who was 52 years old and didn't have a single wrinkle on her face, and she was like a virgin face, never had any tox or filler, and so she has very great genetics.
What's the difference between a mole that's just weird looking and one you should actually worry about?
So we all can have weird looking moles. Just a weird mole isn't as alarming as if your mole is changing, or if you only have one weird mole. If all of your moles have a signature look to them, and you have one standout one that we call the ugly duckling, that would be a worrisome sign. But some of us just have a lot of weird looking moles, and that doesn't mean we have to cut them all off. It just means that we need to monitor them closely. You see us take a lot of photos here. Patients are like, oh my God, another photo. Yes, another photo, because we look at them year after year and make sure your moles aren't changing.
Are there any skin changes people tend to ignore that you wish they wouldn't?
Tend to ignore. Chronic sores that don't heal. Everybody thinks it might be a bug bite or an injury from a rose bush 6 months ago. But if you have a lesion on your skin that has been there for months and does not heal, likely it's something that needs to be addressed. So don't neglect it.
Can you actually reverse sun damage, or can you only prevent more of it?
You can reverse sun damage. We have lots of things that help with that. Topical treatments, chemical peels, lasers, but it's way, way easier to prevent it and way cheaper to prevent it rather than try to reverse it.
Is there a skincare product you take to a deserted island?
A desert?
I don't even know how to say it, actually.
She's in college. Deserted island.
Yeah.
With sunscreen. Yeah.
Does wearing sunscreen every day really make that much of a difference?
Yes. We're all submitted by the same person concerned about sunscreen. Yes.
They
Sunscreen
really want to
every
know if
day.
they have to wear it.
Yes, you guys have to wear your sunscreen. Put it, I tell patients all day long, you set it on your counter, right next to your toothpaste, hopefully you're brushing your teeth every morning, and you put it on every single day after you brush your teeth. Again, like I already said, I tell patients, what's the point in getting your teeth cleaned twice a year, once a year, if you don't even brush them every single day, so put your sunscreen on.
Do collagen supplements actually do anything for your skin?
Nobody knows. We think so, but there's no strong data to absolutely prove that. We know that collagen supplementation doesn't hurt you, so I drink the Kool-Aid, I put it in my coffee every morning, and hopefully it's helping me.
Does drinking more water really improve your skin?
Okay, drinking water is good to help maintain your skin, but drinking a gallon of water is not gonna reverse, fine lines and wrinkles, sort of thing. But yes, you want your skin to stay hydrated, and we do that by drinking water.
Should teenagers be using retinol?
Yes, actually, lots of teenagers use retinol as part of their acne regimen. I don't know that teenagers necessarily need to be using retinol for signs of aging and preventing fine lines and wrinkles, but shortly after that, everybody should probably be using retinol. I wish I started when I was in my 20s instead of in my 30s. So,
At what age would you let your daughter get Botox?
oh, that's cute. Did you write this one?
No.
Let me see your face. Frown. Frown how you normally frown at me. Okay, so when she makes that face at me, it triggers me. So I probably would let her get Botox just to help my own mental health, but she doesn't have, look at me again, frown. She doesn't, and relax. She doesn't have any lines at rest yet, so she's not, at dire need, but frown again, real strong. She has a very strong glabellar complex, so it would be beneficial to her to get some Botox whenever she can afford it, to prevent those lines from forming.
Is there anything you personally would never put on your face?
Ooh, I'm sure, I just don't know what. A patient yesterday asked, she saw on TikTok about lemon juice to lighten her sunspots. I probably wouldn't do that. I don't know, I might have to come back to that. I can't think of an absolute no-no immediately.
When should someone see a dermatologist for hair loss?
Oh, as soon as you notice it. There's lots of different types of hair loss. So as soon as we get a correct diagnosis, we can start doing the correct treatment. And again, it's much easier to treat hair loss early on than once we've lost a significant amount of hair.
Are those rosemary oils and hair growth hacks online actually worth trying?
Or what? Oh, hair loss hacks?
And rosemary oils?
I mean, some of them are not gonna harm you, and some might have some benefit, but again, I wouldn't go into this blindly without knowing what type of hair loss you have, because there's a wide range of reasons why you could have hair loss. So if you're just putting rosemary in your hair, it might just smell good as it continues to fall out if we don't treat it correctly. So,
Can you prevent those bronze scaly patches, SKs, or are those just part of getting older?
yes, we will all get this at some point. So Madison was referring to the kind of brown velvety lesions everybody points out on their skin exams. They're called seborrheic keratoses. You'll hear us lovingly refer to them as wisdom spots, barnacles, gifts from God for getting older. If we're lucky enough to live long enough, we will all get them. Patients all day long ask how they can stop getting them. And I tell them the only way is death, and I don't recommend that. So if you have some that you hate, we can treat them. We easily freeze them off for you. But they
What problem do people tend to be embarrassed about that you wish they'd just ask you about?
Anything in the genital area. Patients will come in for that and beat around the bush and talk about everything else. And then right before I'm about to walk out the door, they'll be finally got up the nerve to say, okay, I got one more spot, or I got one more rash, or I got whatever. So we are not modest around here. We see naked bodies all day, every day. So don't be afraid to bring up any question you have.
What's something patients think is dangerous that usually isn't?
Those brown spots you were talking about, seborrheic keratosis. Everybody thinks they have a melanoma. Thank God there's not that many melanomas. They're normally benign wisdom spots.
What's something you've changed your mind about being a dermatologist?
Something that I've changed my mind about?
Yeah.
Probably the importance of consistent checkups with whether it's your dermatologist or doctor or whatnot. We notice a big difference in patients that come in routinely once a year for their checkups, and then some that have fallen off the radar for 4 or 5 years and they come back, and there's a lot of catch up to be done from the time that they missed. So probably just seeing the importance of being consistent.
After practicing dermatology for years, is there anything that still surprises you?
Yeah, every day, yeah. So we call this the practice of medicine because you are constantly learning. So just when you get comfortable and feel like you can handle anything, you will get a patient that surprises you and humbles you. And but that's what's great. That's one of the things I love about this field. So every day's a new adventure.
What skincare rule are you personally the worst at following?
Staying consistent with a product. So unlike staying consistent with your appointments, which I'm also not great at, but staying consistent with a product. So I will use one product for 3 or 4 nights in a row and then just use another one, whatever I happen to have. And so it's hard to see results when you're jumping around product to product. So listen to what we say, not what I do. Be consistent with your product so you can really see if there's a meaningful difference in your skin.
What's something about being a dermatologist that people would never guess?
Maybe how rewarding it is, and how much effect you can have on patients' lives. I don't think there's a single day that goes by that I don't get a hug or a thank you from a patient or a card. And sometimes you think, skin might be fairly trivial. Somebody with acne or psoriasis or a rash or a minor skin cancer. But that, when you can fix a problem that a patient wears day in and day out, that they can't hide from, you really have the ability to change people's lives. And that's very humbling, and the reason why we come and do what we do. So.
If you could ban one skincare trend from the internet forever, what would it be?
There's probably a lot. But the most annoying one is like the multi-step skincare routines. Patients will come in because they saw a TikTok video or whatnot, and they laid out all of their 10 products, and you gotta have a PhD to figure out even what order to put all of these things in. It's pretty simple. The things you need are, you wash your face, you protect it with sunscreen, nighttime you moisturize it. If you wanna be fancy and do extra stuff like adding in a retinol for fine lines and wrinkles and, slowing the signs of aging, fantastic. If you wanna add in a vitamin C in the morning for antioxidants and extra protection with your sunscreen, fantastic. If we have some skin discoloration that we're trying to lighten and we use some ingredients for that, fine. But the staples are wash, sunscreen, moisturize. All the other stuff is fluff if or when you need it. We don't need 12 different steps, for sure. That's all the ones submitted so far?
Yeah.
Okay.
I had somebody ask earlier, I forgot to write it down it actually went with that question too. They keep seeing the skin flooding. And we talked about it with Anna. Do you know what that is when people put in
Oh,
like
so many
15
things.
products at once?
The problem with that skin flooding, Kristen was saying, is our skin barrier, like its sole purpose is to protect us from the environment, from toxins. Well, that's not its only purpose, but that is one of the important purposes. And when we expose it to so many different chemicals at once, it gets a little freaked out, and inevitably, I don't know of a single person that could tolerate a skin flooding for a significant amount of time, weeks in a row, without getting some form of dermatitis. And so when that happens, when your skin gets a rash or an irritation from all of the ingredients we're putting on it, at that point you just have to stop everything, let it cool down. Sometimes patients have to come in here to get a prescription strength healing cream to kind of reset their skin. But when we do that, we mess up the pH balance of the skin, and we mess up the skin barrier, and your skin's not happy. So don't overcomplicate things.
I think everything else that has come in is pretty, that's the only thing that really stood out that was different from what you've already answered. I think you got it.
Okay, well that was the simplest thing I've had to do all day. All right, thanks guys. Tune in next time.